This is Dr. Gartzliz, and this is the diagnosis of bundle branch block. As always, we begin with the P waves, and when we look at these P waves in this ECG, we see upgoing P waves in the inferior leads. These upgoing P waves in the inferior leads tell us that depolarization is beginning at the SA node and traveling in the proper direction towards the AV node. Then we see how consistent the depolarization is by measuring the distance between the RR intervals, and we see that they are consistent. So between a positively deflected P wave and consistent RR intervals, we can diagnose sinus rhythm. After that, we look at the QRS complex, and we first determine if it is narrow or wide. It is supposed to be less than 0.12 seconds, and we see in this ECG that it is wider than 0.12 seconds consistently. So in this ECG, we have upright P waves in the inferior leads with regular QRS intervals and a diagnosis of sinus rhythm with widened QRSs. So as we look in the V leads, we see that these widened QRSs are consistently through these leads. So since we have a supraventricular rhythm with widened QRS, this almost always is a bundle branch block. So in order to understand a bundle branch block, let's look at how the SA node depolarizes to the AV node, which is normal, but then once the depolarization goes through the AV node, it goes through both bundles of His, but if one of the bundles is obstructed, then the depolarization goes through the other one and then crosses through the ventricular muscle. What this does is delay the depolarization through the ventricles, which widens the QRS, and therefore you have this wide QRS complex. So we have to look and see on our ECG which of the two His bundles is obstructed. And in order to do that, we look at V1. And if V1 is upright, then it is a right bundle branch block. And if V1 is downgoing, then we can conclude that it is a left bundle branch block.